Good morning. Thank you for having me.
Now, when late former President Muhammadu Buhari in 2019 assented to that bill that became an act talking about the prohibition of discriminations against persons with disabilities, a lot of persons felt that that will bridge the gap that we have been witnessing in that area. Talk to us from your perspective, what went wrong regarding that act's implementation and the gaps that we are such that we are still witnessing gaps when we are talking about inclusion regarding the rights of persons living with disabilities.
All right. Thank you very much for that. I wouldn't say that something went wrong. I would just say that there's just been so low implementation of, that act across different sectors. I wouldn't want to say, as we are used to, slow implementation of government policies, but there is still a lot to be done in terms of infrastructure, in terms of policies, in terms of budgeting that can adequately put the recommendations or the provisions of that act in proper place. And that is one of the things that this research work had, sought out to address, to see what exactly is happening nationwide across those 5 areas that we've talked about: policy, healthcare, education, employment, and social protection. What exactly is the state of things? And from the research and the things that we have realized from that, there's still a lot of gaps in that. And I can, in a minute, speak about some of those specific gaps that this research has brought out. One is that many states have not domesticated that disability law, disability act in their states. And that means that concrete actions cannot be taken at the state level when it comes to that act if it is not, domesticated into a state law, which is, as at the time of this report, only about 23 states have actually, enacted that law in their states. There are gaps as it regards infrastructure, right? Many public facilities are still accessible for persons with disabilities. There is still only about 1% of persons with disabilities are employed in the formal sector, with about 90% unemployed. That is practically unacceptable. That is a wide gap, right? So healthcare facilities are not yet tailored to the specific needs of persons with disability, and a whole lot of other things that are happening in that, that found out with this research. This comes down to the fact that enough work has not been done nationwide in terms of the implementation and enforcing, the recommendations and the provisions of the act in Nigeria.